One of our major drivers for change, we're actually our customers, and they were saying, I wish you'd talk to each other. We had a lot of poor communication and resulting in what I always refer to as customer bounce. And what we'd got between the professionals was, oh, interesting to hear what you're saying, but it's not for me to deal with, until I sort of said, well, hang on a minute, somebody's got to work with this person, who's going to work with them. So what happened? About a couple of years ago, we set off down a track of, let's talk to each other about this. Let's talk to social services and health and the voluntary sector. And we sat in a room together and said we could do something different if we actually got together. And one of the things that we did was we have created an integrated health and social care community management structure. The biggest thing that we've done is to develop the community resource teams and the care closer to home ethos. What that's done is it's really brought together all professionals on a weekly basis, religiously. What they do is they discuss the customers in their locality and make sure that not too many people are going into the houses, making sure that they've got the good care plans in place. We've avoided, of the customers that we've seen, 302 admissions. We've seen over the course of the last 2 years something like 2,292 people through that system. Our major outcomes is that we have seen a real decrease in the numbers of people in long-term institutional care. In monetary terms, we've saved £1.5 million in long-term institutional care. But to do that, we have increased the numbers of people who have been cared for in their own home, and that is to the tune of £1.5 million. Where the money is going to be is saving in the acute hospitals. So our next steps, which we're already working on now, using the virtual ward concept. We've been doing a frequent flyer analysis around accident and emergency, and one of our GP practices, one in the south of the county that sees probably the biggest proportion of our population. We've pinpointed a number of customers, and we're actually mapping across all services a selected number of customers, looking at their journeys and getting their stories. What I want to finish off with is just to say that both our culture and our systems are really built around responding to crisis across health, social care, the voluntary sector, everywhere. But what we do need to do much more of is move to proactive case management, because we do know that planned care has a much greater impact, and we mustn't underestimate how complex it all is. And on that note, I'll finish.
Thank you.
Thank you.